And Marie, as a medical provider, do you trust a cop telling you, or does there have to be more of an assessment before delivering care?
You're obligated to do an assessment on every patient you encounter, regardless of the situation. They are not allowed to take the diagnosis from police officers. And even if they did, it would have helped them, because prior to their arrival, the police said we had him in a carotid hold and he vomited into his mask. So the police told him that much, those two paramedics.
And the vomit into the mask, one would think, with no medical training, that, okay, that needs to be dealt with. And also, there has to be some other matters happening. So what happened, do you think? Was this a power dynamic thing where the EMS like, oh, cops telling us what to do, or poor training? I mean, what's your assessment from what we know?
I think it was a combination of everything. It was power dynamic. It was, I want to say, implicit bias. It was the color of his skin. It was the neighborhood. And it was two people, the paramedics, not doing their jobs. Because you cannot inject someone before you assess what's the situation with them physically and medically. And you can't take the word of police officers who diagnose anything. It's not their job. It's your job as a paramedic to assess the patient, see what's going on based on your education and your perspective. So them trying to blame the cops, if that is their strategy and the theory of the case, will fail. I'm a nurse. Before you inject any patient with anything, you must assess the patient. Assess before you inject. Every nurse or medical professional knows that. Assessment is key to everything.